time for the A-Team, and a new study published in the Journal of the American Medical Association shows a link between hormone replacement therapy taken after menopause and an increased risk of death from breast cancer. Our Fox News Medical A-Team is here with the facts, Dr. Mark Siegel and Dr. David Samadi. Okay, Dr. Siegel, let me start with you. We've heard this before, that hormone therapy can lead to breast cancer. What's different about this study? This
time they're looking at the Women's Health Initiative data over 11 years. So they saw things they didn't see before. More invasive breast cancers came out, more estrogen-positive cancers, and more deaths as a result. That's a big take-home here, that we didn't realize that it was going to lead to such aggressive cancers. It's still very small, and it's still only statistical, but it's a reason for women to think twice before going on hormone replacement therapy for a prolonged period of time. I sometimes use it for short periods when women know the risks and maybe they're having severe hot flashes or severe symptoms of menopause. It's still not a great idea, but I will put people on it for short periods of time.
Okay, I want to get back to you in a minute about what else women can do then, but first, Dr. Samadi, there's an interesting tie-in to men here. How?
Well, it's very interesting because there's a concept called male menopause, and what that means is that men, as they get older, their level of testosterone starts to go down, and then they start gaining weight and getting tired, etc. So I see a lot of men coming in and saying, can I have some testosterone? Same exact parallel that goes on with breast cancer we see in prostate cancer. I don't normally write down for testosterone because it increases the risk of prostate cancer. You have to be really careful about these hormones. If you use them for a short period and you're under supervision of your doctors and you're making sure all the tests are in order, then that's okay. But to take them randomly, I think you're going to see the increased incidence of prostate cancer and breast cancer.
So Dr. Siegel, what should women do? Because women go through menopause at a very young age in today's dates and times.
I mean, it's really hard to have a clear answer to that. Some women benefit from antidepressants, some from anti-anxiety agents, some want to tough it out, some can take hormones for short periods of time. It's got to be done on a case-by-case basis, the way all medicine should be practiced.
Mark, what are we talking about? We're talking about osteoporosis, hot flashes, depression, and so
well, those you treat separately, of course.
Right. So you would treat them
separately, not just with
exactly.
hormones.
That would be the,
okay, I got to get to the beer, guys.
Right,
you know, it's 7 a.m. Somebody can drink somewhere. And when we think of a beer, oftentimes we think, especially with a Corona, of having a lime with it. Oh, you guys going to go for it? Okay. But now there's some medical condition that people are out in the sun, they put the lime in, I should say, and they're getting a skin rash? What is it, Dr. Singh?
Well, the way you drink Corona, what normally you basically push the lime into and you start shaking it. And there's a material in this lime called cerulean, which can, make your skin more sensitive to the UVA light, and it can cause discoloration. It's not serious, it's nothing to worry about. The key is to make sure you wash your hands after you do this and don't splash it on any other girls.
It's a rash that you can sometimes get. It's from the lime itself. They've known this for centuries. The Indians used to use this back in the 14th century to increase the color of the skin. Wow. But the take-home here is if you're lying on a beach like in that Corona commercial and you see a woman walking past, don't look. Only look at the woman you're with.
That's the takeaway from this?
That's right.
Has nothing to do with the medical.
It's a rare thing. No, the rash is rare. It can be easily treated, as Dr. Samadi said, but it definitely is associated with the lime, not the beer.
So if you get it on your skin, you should just go wash
it off,
water,
exactly.
and then you'll be fine.
And I still like my Corona and
with
the beer.
my lime.
All right.
Cheers.
Salut. Very good to see both of you this morning.